So today we're going to be taking some body composition measurements in a body composition lab. These are going to be assessed through taking different types of measurements of BMI, body fat percentage, using skin calipers, circumference of body parts, and so we're going to begin. So this is our test subject. He is a 21-year-old male. He leads an active lifestyle. And we're going to begin with step 1 of this lab, which is going to be taking height and weight with shoes on to begin and shoes off for the second part of this step. So we're going to go over to the scale and take weight in kilograms. So we begin by putting the scale in kilograms, and make sure you tear your scale or zero it out before you put anyone on to measure their weight. And so now our test subject is going to step on the scale with his shoes on and take his weight. So with the shoes on, the weight is going to be 95.7 kilograms. So next we're going to measure our test subject's height in centimeters with his shoes on. And we're going to be using a stadiometer in order to complete this portion. After aligning the top of the stadiometer with the test subject, we're going to go down here to read the measurement in centimeters, and the measurement of this test subject is 186 centimeters. Now we're going to complete the same thing that we just did, except the test subject's shoes are going to be off. Again, making sure that the scale reads kilograms and has been zeroed out before the test subject steps on. Once the test subject has stepped on the scale with his shoes off, he reads 95.2 kilograms. I'm going to take the height of the test subject with his shoes off, using the same method that we did earlier with the stadiometer, and align it with the test subject's head. And as you can see, the stadiometer reads 182 centimeters. So we're going to be measuring frame size next, and frame size can either be measured by the width or breadth of the shoulders, or it can be measured the circumference of the wrist, and our test subject and I have chose to do frame size by measuring the width of the wrist. For measuring the wrist circumference of our test subject, we're going to use the inch aside of the tape measure, making sure to tightly wrap the tape measure around the test subject's arm. And it's going to measure 7¼ inches. Based off of the wrist measurement that was 6¼ inches, that equates to our test subject having a small frame size. So the next step in our lab was to calculate BMI using the height and the weight of our test subject without shoes on. So we measured him to be 182 centimeters and 95.2 kilograms. So when calculating BMI, we came up with a 27.2 BMI. Step 3 in our lab is going to be taking circumference measurements of different parts of the body, and those measurements are going to be wrist, forearm, bicep, shoulders, chest, waist, abdomen, hips, mid-thigh, calf, and neck. The first circumference measurement we're going to take is wrist, and we took this earlier for frame size, only it was in inches, so now we're going to take it in centimeters. And the wrist anatomically is the distal to styloid processes with the elbow flexed and forearm supinated, perpendicular to long axis. Make sure the tape measure is tightly pulled. And we're getting a reading of 17.5 centimeters. The next measurement we're going to take is the forearm measurement, and this is the maximum girth of the forearm with the arm hanging down, supinated, perpendicular to the long axis, similarly as taking the wrist measurement. we're going to be getting a reading of 26 3/4 centimeters. The next measurement we're going to be taking is the biceps, and we take this measurement midway between the acromion process and the olecranon process, with the arm hanging down perpendicular to the long axis. And as you can see, we're getting a reading of 31 3/4 centimeters. The next circumference measurement we're going to take is going to be the shoulders, and the shoulders are measured at the maximum bulge of the deltoids inferior to the acromion process, horizontal and at the end of normal expiration. So we're going to have our test subject breathe in, and then expire, and the measurement is going to be 44 centimeters exactly. The next measurement we're going to take is the chest measurement, which is around the torso at the level of the fourth costosternal, which is the rib and the sternum joint, horizontal at the end of normal expiration. So we're going to have our subject breathe in, and then expire, and we're reading 69 centimeters. The next measurement is going to be the waist measurement, and this is taken at the iliac crest, horizontal, and at the end of normal expiration. And you have to make sure at this point that the tape measure stays horizontal to keep the measurement accurate. Find the iliac crest. Ask the test subject to breathe in. And at expiration, we are at 94 1/4 centimeters. The next measurement we're going to take is going to be the abdomen, which is at the greatest anterior protuberance, typically at the belly button. Make sure to keep the tape measure horizontal and take this measurement at the end of expiration. So we're going to locate the belly button. Make sure the tape measure stays at the same level around the circumference of the test subject. Keep the tape, and we're going to be at 93 centimeters. The next measurement we're going to take is the hip measurement, and the hip measurement, also known as the buttocks measurement, is going to be at the maximum posterior extension of the buttocks, horizontal, making sure the tape measure stays horizontal. And we're going to read 109.5 centimeters. The next measurement that's going to be taken is the mid-thigh measurement, which is measured midway between the crease in the knee and the proximal border of the patella, with your knee flexed 90 degrees perpendicular to the long axis. And as you can see, it's going to read 56 3/4 centimeters. The next measurement that we're going to take is the calf measurement, which is measured at the maximum girth of the calf while the subject's leg is bent, non-weight bearing, at 90 degrees, perpendicular to the long axis. And as you can see, the circumference is going to be 46 centimeters. The next and last measurement we're going to do for circumference is going to be the circumference of the neck. The circumference of the neck is measured just inferior to the Adam's apple, perpendicular to the long axis. So you're going to locate the Adam's apple, and directly inferior is going to be right there. Keeping the tape measure snug. we're going to get a reading of 40 centimeters. After recording the circumference measurements, we're now going to take a waist to hip ratio, which is going to determine the risk for obesity. So our client's waist measurement and hip measurement were divided by one another, and we came out with a ratio of 0.8627, which means that our client is at low risk for obesity. Step 5 of this lab is going to be to use a skin fold caliper. So right here we have a Lang skin fold caliper, and we're going to use that caliper in order to take skin fold measurements. And so we're going to begin by taking measurements of the chest, waist, thigh, suprailiac, triceps, biceps, mid-axillary, subscapular, and calf. We're going to begin with the chest skin fold measurement, and when completing a skin fold measurement, this is the protocol that you're going to follow. You're going to pinch the skin where you're going to be taking that measurement, and then a centimeter below where you have that pinch is where you're going to apply the caliper. You're going to squeeze while still remaining pinched, and this is going to be a reading of 9 millimeters for the chest. The next measurement we're going to take is going to be the waist or the abdomen skin fold measurement, taken with the same protocol of pinching the skin, applying the caliper a centimeter away from the pinch, pinching with the skin fold caliper while keeping the pinch of the skin still remaining, and we're going to get a reading of 25 millimeters. The next measurement we're going to take is going to be the thigh skin fold measurement. Coming right here, applying the caliper a centimeter up from the pinch, and we're going to read 17 millimeters. The next measurement we're going to take is going to be the suprailiac skin fold measurement, taken right above the iliac crest, remaining pinched. We're going to get a reading of 20 millimeters. The next measurement we're going to take is going to be the tricep skin fold measurement. Taken in the middle of the tricep, you're going to pinch the skin, apply the caliper a centimeter up from your pinch. We're going to get a reading of 11 millimeters. The next skin fold measurement we're going to take is the biceps skin fold measurement. Pinching in the middle of the biceps, placing the skin fold caliper a centimeter below the pinch, and getting a reading of 9 millimeters. The next skin fold measurement we're going to take is the mid-axillary, which is going to be right under the armpit. And a pinch, apply the skin fold caliper a centimeter above, and get a reading of 14 millimeters. The next measurement we're going to take is going to be the subscapular measurement. I'm going to come around, pinch the skin, centimeter up, and we're going to get a reading of 19 millimeters. The next and final measurement we're going to take is going to be the calf skin fold measurement, and we're going to pinch right in the middle of the calf. There's not much to pinch. And we're going to get a reading of 6 millimeters. Thank you so much for watching, and that's going to conclude the body composition lab. Normally in a lab setting, following the last step, you would take 50 skin fold caliper measurements in order to acclimate yourself with taking skin fold caliper measurements. Typically, you are considered an expert at taking skin fold caliper measurements once you've taken 100 measurements. So 50 gets you about halfway there. So that's going to conclude this portion of the video. Thank you so much again for watching, and have a great day.